Okay, I have a presentation of 25 minutes. You will lose 10 minutes of the content. So, but before, no need to sorry. But this is live. Now, for the 15 minutes that I have, I would like, first of all, to invite all of you to stand up, move, shake your hands, yeah, jump up and down for as long as you want. Well, you can listen to the presentation while standing. Yeah. Okay. Let's go. I will skip this first part and I'll skip my picture. And I'll go straight on to this paper with 13 authors, half of them medical doctors, half of them public health doctors. Okay, this is the interesting part. I think yesterday, if you were here, you would have met Asclepius, the god of medicine, powerful. He could heal all kinds of things. He could make the sick people back to health, what our current day doctors are doing. He could also raise the dead, bringing dead people back to life, something that our doctors cannot do today. When one is dead, one is dead. And in fact, Asclepius was killed by another very powerful god because Asclepius was accused of bringing too many dead people back to life. Asclepius has two beautiful daughters. Because they are goddesses, by definition, they must be beautiful. One daughter, Panacea, was the goddess of treatment. She could cure all the diseases and prolong life indefinitely. She can make people live forever, something that we are hoping to do. We are extending the life expectancy, but we haven't done that. The other daughter was Hygeia, the goddess of wellness, in charge of health, making the environment clean, preventing diseases. If you would like to get all these data, there is this publication in 2022 with exactly the same name as this presentation. So if you go there, you can find all this information. So medicine, long time ago, subsequently became two areas: clinical medicine and public health. It worked well for quite a long time. The clinical doctors were in their clinics, hospitals, treating patients. Public health people work in the government setting and local health departments, keeping the environment clean and stopping germs from spreading, again, quite well. But things changed. In the modern world, we have a number of bad things. This is called the wicked problems. Complex problem that is difficult or impossible to solve. This is a traditional problem. For example, smoking causes lung cancer. Drinking alcohol causes liver diseases. One cause, one effect. But look at climate change. What causes climate change? Greenhouse gases. But it is much more than that. The second one are the mega trends. These are the global trends that are slow to form, very slow, over decades. But once formed, has widespread impact, which is difficult, if not impossible, to reverse. So these include climate change and even the obesity epidemic, it comes on after several decades, but once it is on, there's no way to stop. It has a life of its own. It will go on heavy, a great, a lot of momentum and inertia. Syndemics, these are the synergistic epidemic, which means in one epidemic, there are in fact several epidemics combined together. For example, infectious disease and chronic disease occurring at the same time. COVID-19 is the best example. A lot of people think that COVID-19 is an infectious disease epidemic caused by a virus. No, I'm going to show you that this thinking is wrong. Now, under this kind of situation, we need the clinicians and the public health professionals to work together. Otherwise, we are not powerful enough. We need the two gods to work together. And if we look at their mandates, they have a lot of things in common. Clinical medicine assess individual health status. Population health assess population health status. This one distinguish between the ill and the well. This one, health surveillance, care for the ill, health protection, cure illness, health promotion, prevent illness, disease and injury prevention, emergency medicine here and emergency preparedness here. They're basically the same objectives. Why cannot, what can they not work together? Yes, they can. In what way? Basically, if we look at clinical medicine, they work on the individual level. They see individual patients in the hospitals, in the clinics. Population health is on a population level. It's just that. But sure, they can work together. Clinical medicine mainly treats sicknesses and public health promotes health. And again, these are the two ends of the same spectrum. An example of a wicked problem, a megatrend, and a syndemic is the COVID-19 pandemic. I guess most of you would know about this. In 2019, the last day of the year, China CDC reported to WHO a cluster of 41 pneumonia cases with unknown cause. And this is the reason why it is called COVID-19, not COVID-20. It was first reported in 2019. And then there was a confirmation of a human-to-human transmission. One patient infected 15 hospital staff in Wuhan. And of course, this caused a lot of concern, and quickly it initiated a lot of urgent work in the world. A year later, WHO approved the first COVID-19 vaccine. This is a great and very severe kind of pandemic. These are the mass graves in early 2020, like that, and comparable to the time of the Black Death. In the last 3 years and 3 months, when the WHO declared the COVID-19 a public health emergency of global concern, we have had 765 million cases, 6.9 million deaths, making this one of the deadliest pandemic in the history. This is a parade of all the major pandemics worldwide in the history of humans. From very early, like 2,000 years ago all the way to current time, and we can line them up in the sequence of the number of deaths. Black Death is still the number one. COVID-19 is number 7 here. So during the COVID-19, clinical medicine had done a lot from their perspectives, like testing for COVID, the developing rapid tests and the more definitive tests. They work on vaccine research, laboratory studies, new vaccines and treatment research, drugs, antibodies. Public health, on the other hand, they work on surveillance, contact tracing, model research, the dynamics of transmission, impact of intervention, and also prevention research. And they complement each other. All the things that happened during the 3 years was caused by the virus, which has no legs, no wings. How come it became so powerful to have almost decimated the human population? How did it move around the world? The viruses couldn't do that. We did that, humans. First of all, very early on, we know that we should not shake hands because it is dangerous. We can pass on the infection to other people. Why? Because we sneeze and we use our hands and we do not wash our hands. And so the germ, the virus was passed on. And we know that this is a person sneezing. The green line shows the droplets, which means that they are more than 5 microns in diameter. They can travel 2 meters and will remain in the air for 5 seconds. The other ones, the red ones, are the aerosols. They are much smaller, 1 micron in diameter. They can travel 8 meters when you sneeze with the aerosol, 8 meters, 24 feet. They would stay in the air for 12 hours, which means that if someone goes into an, do you call it elevator here or lift? Doesn't matter. Say elevator, you push the button and you go up. That person, if that person was a case, even after he or she left the elevator, within 12 hours, when you step in, you will still get the infection. So, round table discussion, no. Beach parties, no. This picture was taken of a beach party when the social distancing laws were enforced, and after taking this picture, you see the police coming in and get all of it. We fly. This is the problem. We kept flying to other places, clean places, and infect them like that all over the world. The new social norm. Remember Sunday afternoon in the park? This was in New York City, 2020, San Francisco, Toronto. This was a teaching at home program, Cali, Colombia, Bangkok, Chiang Mai, Thailand. Very ingenious. These were designed by both the doctors and the public health professional, 3 meters away. Bangkok, Thailand. Maybe you cannot see it. There's a plexiglass here, transparent, separating the 2 people. In France, it is a lot more romantic. In Amsterdam, Now, the COVID, this was the initial 198 days, the initial half a year. The trend was rising so high that it overburdens the whole healthcare system. And public health has to do something, how to prevent that. And this flattening the curve concept was developed without any public health protection measures. This is the amount of disease burden coming to the hospital. This is the healthcare capacity. You can see that we have exceeded too many patients. Many of them were lying in the corridors of the hospitals. The only way is to use protective measures like physical distancing, face masking, and so on to keep it low, below the healthcare system capacity. Long-term COVID is another problem that we need a collaboration of clinicians and public health professionals. Now, COVID-19 is not just an infectious disease. It is also a chronic disease. Physical health, during the 3 years, have you been going out for jogging or doing your regular exercise outside? No. So overeating, under-exercising is one problem. Mental health. Equity issues. There were some reports about racial discrimination and so unemployment, psychological health like committing suicides, family conflicts, social conflicts like riots, and the upbringing of the next generation. Schools were closed. These are very long-term effects that will go into our next generation. So people might think that COVID-19 is an infectious disease, and once it is over, it is over. Right now, it is all over. It is, but the COVID-19 is only the initial phase of the pandemic. We are now celebrating, but when everyone is celebrating the end of the COVID-19, another silent but potentially more deadly chronic disease pandemic might have just begun. Look at this. In terms of collaboration of clinical medicine and public health in surveillance, the first thing we need to do is to invite clinicians to come to surveillance meetings. It cannot just be public health professionals and surveillance experts. In terms of data collection, we need a good clinical case definition of the long COVID and also positive health indicators. In terms of interpretation of data, the physicians can help the public health professionals to identify early warning signals from their clinical perspective. In terms of dissemination of results must be provided to data providers. The clinicians are the data providers. They give you the data, and they must be receiving the reports and findings. In terms of people who need to know and to act, we need to inform the actors about surveillance. Clinicians are treating patients so they can best educate and provide health messaging. So we want surveillance to be not ending with information dissemination. We want it to end with public health action. And we need the physicians to work with public health to come up with solutions. actionable information. We need them to do surveillance of surveillance. The surveillance system, is it working well? We don't know. We need the users to help and police the policies. The human history is the history of continuous fight against ill health. So we have seen this parade of pandemics. Pandemics are like nasty storms. They come and go. No matter how bad the storm is, eventually the sun will come out. As soon as a storm is over and the sun is out, the next storm is brewing. So right now we have the sun coming out, more or less today. Yesterday was a lot of rain, but we should not be too happy because we know that there will be rain coming another time. And so in order to prepare for the next one, the clinicians and public health professionals should work together and do the preparation. Thank you.